Hello, my name is Juan, and I am performing a trauma patient assessment on a 24-year-old female who was ejected from a motorcycle during an accident. I will be verbalizing every step of my assessment and treatment plan as I proceed. First, I'm going to be ensuring BSI PPE, and I confirm the scene is safe to approach. The scene is safe, and law enforcement has cleared it based on the dispatch information. I'm going with mechanism of injury, being ejected from a vehicle or motorcycle. I anticipate serious trauma and will take full C-spine precautions. I confirm this is my only patient and request an ALS due to the severity of her injuries and mechanism of injury. Next I'm going to form a general impression. My general impression is a young adult female lying 30 feet from her motorcycle, likely with multiple injuries. I check her level of consciousness using AVPU. Make sure she's alert, verbal, pain, and unresponsive. Make sure I'm gonna check AVPU. The patient responds only to pain, indicating alerted mental status. Moving to the primary assessment, I'm going to check my ABCs. After I'm gonna go with airway. I'm gonna make sure it's clear with no obstructions. The patient is breathing rapidly, and breathing respiratory rate is elevated at 30 breaths per minute. I check for lung sounds and no decreased breath sounds on the left side, which could indicate a pneumothorax, basically a chest injury. Circulation, the radial pulse is weak and rapid at 130 beats per minute. Skin is pale, cool, and diaphoretic, suggesting shock. I look for major bleeding and find minimal bleeding on the lower leg, but no active bleeding. Because of her respiratory distress and suspect chest injury, I apply high flow oxygen via a non-rebreather mask. So given her weak pulse, pale, cool skin, and mechanism of injury, I treat her for shock and prioritize immediate transport. I obtain I I try to obtain sample history, but since she's unresponsive, I proceed with secondary assessment to head to toe exam using DCAT BTLS. Make sure for there's no any deformities, abrasions, punctures, um, burns, lacerations, tenderness, and swelling. We're gonna start from the head. Pupils are equal and reactive to light. No fluid from ears or nose. Neck, no jugular vein distension or tracheal deviation. No obvious injuries. Chest, stable or on palpation, but patient responds with pain. I'm gonna check the stomach, soft and no tender in all quadrants. Pelvis stable on gentle compression. I'm gonna check the extremities. Palpation reveals deformity in the lower right leg with pain. Pulses are present distally in both feet and hands. I plan to immobilize the patient on a backboard with spinal precautions and splint on the leg of the injury. I obtain baseline vitals, blood pressure is 92 over 68, pulse 108, respiratory rate 22, indicating some improvement but continued instability. I will continue to reassess vital signs every 5 minutes since it's a high priority patient. Monitor breath sounds, distal circulation, and neurological status during transport. And in summary, this patient requires rapid transport due to altered mental status, respiratory compromise, possible shock, and multiple traumatic injuries. I have initiated oxygen therapy, spinal precautions, and immobilization, and have requested ALS backup for advanced interventions. And thank you for watching my trauma patient assessment and management. Thank you.